Hello all, this is Mrs.Lalithamani, Associate Professor from SNS College of Nursing. In this lecture series, we are learning about the trigeminal neuralgia, a disease condition that is caused by the neurological impact. So the nerve which is impacted is the trigeminal nerve, which has 3 branches. So we will be knowing about which region it will be affected if the part of the nerve is affected. So far we have seen about what is the definition, types of neuralgia, what are the triggering factors, causative factors and all. Now we will see about the treatment options. So medical treatment, the condition first will be treated with medications, that is first line carbamazepine or Oxcarbazepine. So carbamazepine is a drug of choice which will be given at the first line of medication, and Oxcarbazepine is also given. So coming on to the other drugs, gabapentin, baclofen and lamotrigine will be given. The side effects and long-term effectiveness will vary. So while we are checking about the drug choices, we need to find out that this is carbamazepine or Oxcarbazepine. Other drugs like gabapentin, baclofen and lamotrigine. So the side effects and long-term effectiveness may vary depending upon the drug choice and the patient. So coming on to the surgical treatment options, there are microvascular decompression, that is a MVD. The condition is called as microvascular decompression, where the pressure which is compressing the nerve will be released. So that it relieves the nerve compression so that the symptoms will get relieved. So coming on to the second option, that is rhizotomy. It destroys parts of the nerve to block the pain. It destroys part of the nerve to block the pain. So that is the second option, rhizotomy. Third one is gamma knife radiosurgery. In the image you can see how the gamma rays are being focused so that the radiation is given to damage the nerve fiber so that the effect will be seen. So coming on to the complications, there will be loss of corneal reflex because of this surgical procedure and the disease condition, loss of corneal reflex, retrobulbar hematoma, carotid puncture, meningitis, intracranial hemorrhage, pain-related disability, and the patient will be ending up in anxiety, depression, weight loss due to difficulty in eating, because we have seen that the patient will be complaining about the pain while eating, chewing or even while mild touch. Even the air touch will cause the problem. So loss of corneal reflex, retrobulbar hematoma, carotid puncture, weight loss, meningitis in ICP, intracranial hemorrhage will result in. Coming on to the prognosis, when we think about prognosis, so the early diagnosis, when whichever condition it is happening, the early identification and treatment will improve the outcome. Without any doubt, we will be knowing that the early intervention or early medical management, either it might be surgical or it might be a pain management, whatever the case is, it will be having a better outcome. So coming on to the continuum given below, there will be period of pain episodes and then there will be remission, pain-free period, and there will be an episode of pain along with the followed by the pain-free period. So the remission, relapse, recurrence, the manifestations with the duration alone will, first time if there is a smaller impact period, next there will be longer pain-free period, and it will be gradually increasing and the person will be with the disease in the later stage. While coming on to the nursing management, we can remember with a mnemonic, that is neuralgia. It is a term used to remember that how this nursing care focus areas can be highlighted. One is that is a nature of pain. We need to find out what is the nature of the pain, which is triggering the patient's pain. Second one is eye care. The patient needs to be given an eye care because we know that the compression may optic nerve, olfactory region, everything will be having an impact. So go with the eye care and look into the part of unaffected side and find out whether any transmission of impulses or the problem is proceeding to the opposite side. We need to focus on the unaffected side also. And then coming on to the retinal hemorrhage, whether there is any problem in the retinal, and that is assessment of pain, loss of nerve impulses, spinal nerve, and we will be finding it out the hygiene also. So coming on to the neuralgia is a mnemonic to identify to help in the nursing management. So far we have seen about in this series we have seen about medical management, surgical management, what is the prognosis, how the complications can be identified and handled, including the nursing interventions, where we will be talking about the mnemonic neuralgia, neuralgia. So far, thank you for watching this video. Thank you very much.